Congratulations on your decision to travel abroad during your time at The Ohio State University. Internationalizing your education is an important first step toward a larger global competence. The Office of International Affairs wishes you safe and happy travels. In this section, we'll go over a pre-departure checklist that pays particular attention to matters of health and safety abroad. In this module, you will learn about important first steps regarding your travel documents, useful country-specific resources provided by the U.S. Department of State and the Centers for Disease Control, among others, how and where to arrange an international travel consultation, and the reasons why this is so critical to your overall well-being abroad, managing pre-existing conditions and good strategies for staying well, using the International Supplemental Health Insurance and its many resources. We will refer often to the supplemental insurance you will have throughout this module, and please notice that an entire section at the end should address your basic questions about it. Let's get started. All international travel requires that you have a valid passport. To be considered valid, a passport typically needs to have at least 6 months validity past a traveler's return date and at least 2 blank pages. If your passport does not meet these basic requirements, you'll likely need to take action. Please be in touch with the Office of International Affairs or your program's organizer if you're unsure. Once you have your valid passport in hand, be sure to make plenty of clear copies of the picture or data page of your passport. A clear copy is one that allows you to read all the information on the pages. It's a good idea to travel with a copy of your passport. Although the original will be required for all official travel and immigration purposes, there are occasional and very specific circumstances where a copy can be used. Additionally, a copy can sometimes expedite the replacement of a lost or stolen passport. Please remember, though, that the copy contains all the same sensitive information that the original does, so you'll need to show great care with the copy as well. Your passport should always be kept in a secure location, in a travel wallet or belt, in a hostel or hotel safe, in an inner pocket, or under your clothes. If lost, passports generally must be replaced by a visit to the nearest embassy or consulate of the issuing country. There's a link to the process for replacing a lost or stolen U.S. passport in the resources section for this orientation. We advise care with passports so you never need to access that information. Sometimes a passport isn't enough to get you where you're going. Some countries require certain travelers to apply for a visa. A visa is an endorsement in your passport that allows you to enter, to transit, and to remain in a country. Whether or not you need a visa depends on your nationality, your host country, the purpose of your travel, and the length of time you'll be there, among other factors. Some visas require a lengthy application process, so make sure that you're researching what you need well in advance of departure. The Office of International Affairs frequently partners with a visa processing service. They're a great resource for travelers with questions. Once you've received your visa, if necessary, please make sure to make a copy of it and store that copy in a secure location. A good traveler is a prepared traveler. You can and should begin researching your host country as early as possible, and there are a number of reputable resources available to get you started. The U.S. Department of State has a range of resources available to the general public on its website, travel.state.gov. Prior to departure, it's a good idea to learn more about your destination using their provided country information pages. These overviews will provide you with basic information such as visa requirements, safety and security, local laws and special circumstances, health, travel and transportation, and local embassies and consulates. The U.S. Department of State website also provides a fairly comprehensive traveler's checklist that can help to organize your pre-departure preparation. We also ask that you enroll in their Smart Traveler Enrollment Program prior to departure. The U.S. Department of State has created a number of specific resource pages for students, LGBT, women, and travelers with disabilities. Last but not least, the U.S. Department of State designates some countries as carrying potential risk for U.S. citizens. Depending on the seriousness of the risk, a country may either have an alert or a warning. You can learn more about these designations by visiting U.S. Department of State's website. The Centers for Disease Control also offers an entire section of its website to international travel and to information about specific destinations. This website will outline recommended and required vaccines, health and safety tips, and health-related packing lists specific to your destination. The Office of International Affairs strongly recommends that all travelers schedule an international travel appointment with a healthcare professional at least one full semester before departure. This appointment is intended to help you assess any and all health issues relevant to your overseas experience, including vaccinations and boosters. We encourage you to take this appointment seriously and to schedule it as early in your pre-departure planning as possible. As Ohio State students, you're encouraged to take advantage of the travel clinic located at the Wills Student Health Center. Students may schedule an appointment online via MyBuckMD connection or by calling 614-292-4321. Please specify that you're scheduling a travel consultation. If you're not local to the Columbus campus, the International Society of Travel Medicine offers a searchable listing of its member clinics by state on its website. Wherever you make your appointment, make sure that the healthcare provider with whom you'll be meeting has the following facts in advance: your specific destination, duration of your time abroad, expected activities, your immunization record, a complete list of your medications, prescription and over-the-counter, and your complete medical history. Having these details in advance will help your healthcare provider to give you the most complete and specific consultation. Additionally, you might want to talk to your healthcare provider about the following topics as they apply to you. Only a healthcare provider can advise you on what vaccines or boosters you should get prior to traveling abroad. Please keep in mind that some vaccines are given in a sequence, and the full sequence can take several months. Plan ahead as much as possible. Occasionally, students travel to countries that require proof of certain vaccinations in order to enter the country. Please refer to the country-specific information provided by the U.S. Department of State and the Centers for Disease Control in consultation with your healthcare provider to see if this requirement applies to you. If you're currently taking prescription medication, it is critically important that you continue to do so according to your doctor's instructions for the full duration of your time abroad. Some helpful tips for traveling with prescription medications include: when possible, take enough to last for the full duration of your time abroad, plus an additional 10 days. Leave all prescription medication in its original packaging. Ask your prescribing physician to draft a short note indicating that you're a patient in his or her care and that you're traveling with this medication under instructions. This note should include details such as the medication's generic and brand names, the dosage, and the amount you'll be traveling with. Keep this note with these medications for the full duration of your time abroad. Pack all prescription medication and the notes that go with them in your carry-on and not in your checked luggage. It's important to realize sooner rather than later that some medications that are prescribed in the U.S. are not legal in other countries. Similarly, some prescriptions cannot be filled in large quantities because of U.S. law. You can begin researching how to travel with your prescription medication on the GeoBlue Students website. It's also worth noting that not all over-the-counter medication available in the U.S. is readily available overseas. If you take something regularly, it might be a good idea to pack some for your travels as well. Sometimes, however, these medications are not available overseas because they're not legal. So, do make sure to do your homework before you pack your bags. An increasing number of students are traveling with restricted diets, which include but are certainly not limited to vegetarian, vegan, kosher, halal, or allergies to gluten, nuts, lactose, or shellfish. It's important to start thinking about how to travel with restricted diets and to start developing strategies for staying healthy. Accommodations abroad may be harder to come by than in the U.S. Start preparing now. Learn related vocabulary in the language of the host country because it's important to be able to navigate menus and ingredient lists. Companies like Select Wisely and Brokerfish sell translation cards for a range of diets and allergies that can speak for you. Remember that you may need to communicate these dietary needs to the airline and/or to an in-country provider. Make sure to discuss your full medical history with your healthcare provider prior to departure. It's critically important to think about how to manage your health in your particular host country, how you might be impacted by your condition in the familiar setting of the U.S. may be very different from how you're impacted once overseas and in a completely new environment with new people, new foods, new cultural cues, and a new daily routine. Even under the best of circumstances, international travel can cause anxiety, jet lag, gastrointestinal distress, and fatigue. Students with pre-existing conditions can find their symptoms aggravated by all this newness. In consultation with your healthcare provider, make sure that you identify any triggers that you might have and think about ways to minimize their impact in this new context. Research the destination dashboard provided by GeoBlue students to see what doctors and specialists will be in the area who can help if needed. Activate or reactivate a file with Student Life Disability Services. Act as your own best advocate. If something is wrong, speak up. Any student traveling under the auspices of The Ohio State University is required to carry supplemental international health insurance. Students traveling on programs offered by the Office of International Affairs will be enrolled in this insurance automatically. Students traveling independently with student organizations or with units outside the Office of International Affairs should visit the OIA website in order to begin the application process. Anyone with questions about this process should contact the International Risk Manager. This international insurance is a supplement to and not a replacement for your primary health insurance. GeoBlue provides a comprehensive range of services to those covered by their policies. Once you've received your insurance card via email, please make sure to log in at geobluestudents.com using your name and unique certificate number. Once logged in, you can customize a personal page for your travel that will allow you to create a destination dashboard with customized health and travel security information for your travel destinations. Identify access to doctors, hospitals, and pharmacies in or near your overseas destinations. Pre-schedule appointments with local medical providers to manage your health. Access translation and equivalency guides for prescription drugs, medical phrases, and medical terms. View security travel profiles for your country, as well as most capitals and major cities. Find local emergency contact numbers and directory information for embassies and consulates. Set personalized news alerts for health and safety news updates from GeoBlue. These benefits clearly illustrate just how well this supplemental insurance will start taking care of you from the moment of your enrollment. Make sure that you look into the full scope of their services. In Module 2, we'll talk about how this insurance works when you're abroad. This health and safety module has outlined some of the major ways you can start preparing for your time abroad. As you've clearly seen, the preparation for a study abroad experience is more than packing lists and Facebook groups, although these are important too. Use this time to start thinking about the best ways you can take care of yourself in a new environment. To help, we've created a pre-departure checklist that includes the topics we've just discussed. Please take a moment to complete the quiz for Module 1.